guys, welcome to the lesson on biopsies. So biopsies are used to diagnose disease in tissue or fluid of the body. So during the procedure, the site is numbed, usually with lidocaine, and the patient might be sedated as well. So radiology guidance might be needed, like in this picture where they've inserted the needle into the lungs to do a lung biopsy. And this is where some tissue will be removed from inside the lung. So the specimen is then sent to lab for testing. So the doctor might order a biopsy if the patient has a suspicious lump, some sort of infection in the tissues, or inflammation, like, for example, in the GI tract. It could be inside or outside of the body. So next, let's discuss the different types of biopsies. So there are different types of biopsies that might be done to obtain the specimen that's needed. So needle biopsies might be done to aspirate fluid from within a tissue, within an abscess. A core needle biopsy, also known as a punch biopsy, like in this picture, is done with this tool here where it takes a piece of the skin out. See how it's removed right there? During an excisional biopsy, an entire lump, like for example, if there's like a big old tumor or cyst, they might remove the entire thing. Incisional biopsies are where just part of it is removed. Endoscopic biopsies are done in the body, like in the lungs or the GI tract, with a camera for guidance. Let's explore what the nurse's role is in the biopsy. So if a biopsy is ordered for your patient, make sure you explain the procedure to them and have them sign that consent form. Ask the surgeon or doctor what supplies they might need so you can get it ready for them in the room, like lidocaine or any sedation. So right before the procedure starts, a timeout should be done. If the doctor tries to start without it, make him stop and do that timeout to make sure it's the correct patient, procedure, and site. This is very, very important, guys. If the biopsy is guided by X-ray, you're going to want to use radiation precautions to protect you and the patient. This means covering areas of the body that don't need to be exposed to the radiation. So you will hand the doctor supplies as he needs them. After the procedure, make sure you bandage that site, take that specimen down to the lab right away, and assess the site for bleeding or redness. And with that specimen, please make sure you put the patient's name and date of birth on that, okay? So the priority nursing concepts for the patient with a biopsy are patient-centered care and tissue skin integrity. All right, guys, so let's review the key points about biopsies. So a biopsy is where the tissue is removed for testing or diagnosing disease in the patient. So a doctor might order a biopsy if the patient has a lump, inflammation, or infection somewhere in the tissues. Before the procedure, make sure you explain to the patient what will happen and have them sign a consent form. Ask the doctor what supplies you might prepare for him to get everything ready. So during the procedure, make sure you do a timeout right before it starts. Make sure it's the correct patient, procedure, and site. If it will be guided by X-ray, make sure you use radiation precautions to protect you and the patient. Provide the supplies to the doctor as needed. After the procedure is over, cover that site, send that specimen down to lab with the patient's name and date of birth on it, and assess that site for any redness or bleeding. Okay, guys, so that's it on biopsies. Now go out and be your best self today, and as always, happy nursing.